Really excited to share with you about the medical assisting program at Mercy College of Health Sciences. We've prepared a really great information session that's on demand. You can access it whenever you want. We know that life's busy, so hit pause, restart whenever you need to, and that's the purpose of this. It's on the go, it's flexible, a lot like our MA program itself. With that being said, today's presentation is going to include an overview of everything that you need to know about our medical assisting program. We're going to do some introductions with your enrollment team, and really we're all here to help you be successful throughout the program. So you're going to get to know each of us. We're going to talk about what even is a medical assistant and get you familiar with the role, with the job duties of what you're going to be doing in this field. We'll talk about the job outlook. It's growing. Just a disclaimer, it's really exciting to see how much this position is growing and what we're seeing as a trend over the next few years. We're going to go into detail about that, as well as an overview of the program. What will your life look like as a Mercy College medical assisting student? The application process. We're going to get you equipped with the steps that you need to go start to finish through our admissions process to get you successfully enrolled into the program. And then we're going to conclude with some ways that you can stay in touch with us and connect with Jen, our wonderful enrollment coach that we have with us today. All right, so first we're going to cover your enrollment team. So this is going to be your support team. We're all your cheerleaders while you are starting the program and going through it. And I am going to start off with having Professor Barnard give an introduction.
Hi, thank you, Katelyn. My name is Ashley Barnard. I'm the Medical Assisting Program Chair. My background, I actually went through this program a few years ago. I worked full-time while I did so. Had the flexibility. I do have a family, 3 kids, so it's busy schedule, so it was really great to have that online component. I do have a bachelor's in education, so that kind of brought me back to the role of instructing. So will have me as an instructor throughout the course, and I'm excited to have you guys here.
And my name is Jenn Amaya. I'm the enrollment coach here at Mercy College, and I work with medical assisting students from application through admission all the way through graduation, and also your academic advisor. So I help you through the application process and enrolling courses, liaison to the campus for you, working with financial aid as well as other campus offices. So I'm here to support you throughout the process as well.
And my name is Katelyn Schmitt. I'm the Director of Enrollment Management. So I am here to support you along the way. I work really closely with both Jen and Professor Barnard and have helped bring this information to you today. So let's go ahead and dive in. That we have talked about introductions. Now we're going to discuss the role of a medical assistant and what you would be doing on a daily basis in this profession. So with that, I want to turn to our expert here, Professor Barnard, to give us this overview.
Yeah, so the role of a medical assistant, it is so versatile. You can work up front, checking in patients, be the face of the clinic, reach out to insurance companies. You can work in the back of the clinic. That includes assisting the provider with in-office procedures, taking patient medical history, taking vitals. You might administer medications, even draw blood on patients, work in the lab, call patients with test results. You're really there working with the providers. You work closely with them. You help out maintaining kind of the flow of the office, keeping that provider on time with their schedule. Like I said, it's so versatile. Everything that you do are able to do in that office.
All right, and the career outlook, as we alluded to earlier, is looking really, really bright for medical assistants. So Professor Barnard, would you be able to give us an idea of what we're seeing over the next few years in the workforce?
It is just growing so much. I have clinic managers all the time asking me, when's the next cohort graduate? Who can you send our way? They need to fill these spots. It's all over the country. It's growing so much with nurses being pulled into the hospitals. They want those CMAs in the clinics.
Absolutely. And I want to highlight some of the growth statistics. If any of you really like to rely on those solid facts to make decisions about what you're doing in your education and in your career, we're anticipating growth of 14% over the next 10 years for the medical assisting field. And just as a comparison, the average occupation is growing at just 3%. So this is significant growth in comparison to the average population. We're seeing 115,000 openings every single year. And so this truly is a crisis and a shortage within the healthcare industry that you can actually help solve in just a year's time, jumping in and completing this program in a very short amount of time so that you can make the maximum impact entering the field in just 12 months down the road. All right, now we know that there are a lot of medical assisting programs out there. In fact, there are thousands around the country, but there are some factors that make our program stand out in quality, in the length of the program, the cost of the program, the flexibility, and these are just a few of the factors. But I'm going to have both Professor Barnard and Jenn go over some of the things that make our Mercy College program stand out.
Yeah, so we are fully accredited with KHEP. I work closely with our accreditors to make sure that we cover everything that needs to be covered and that we stay up on that. After this program, you do qualify to sit for the CMA with AAMA. That is one of the most prestigious exams you can take. There are other ones you can take, but this is the top one, and not all programs are linked with the AAMA. You are able to work full-time with this program because it is 100% online. There's a couple in-person components. We'll go over that in a minute, but like I said before, I did work full-time. It is asynchronous, so you can jump in your classes and do assignments on your schedule. You don't have to be signed in at a specific time. And then we do have nationwide partnerships. I have cohorts in several different states. While we are located in Iowa, I have them all over the country.
And Professor Barnard alluded to it. It is a very flexible program. It's a hybrid format, which means that the coursework is all online. There is no set class time that you have to log in like at 3 o'clock on a Tuesday. It's whenever you have time in your schedule, which makes it very flexible. It's designed for working adults. Hybrid meaning that there are some in-person components, and we're going to talk about that more in depth shortly, but I'm not going to go into that at the moment. It is a one-year program, so there's 3 semesters in that 1 year. So in 12 months, you could be working as a CMA, which is a really exciting development in your life. It's a really awesome opportunity. Not to mention it's a low cost. It's a very affordable program. At the time of this recording, it's a little bit under $11,000 for the duration of the program. That's all 3 semesters. But I can guarantee that it is very affordable regardless of the exact cost. And I can provide details of the exact cost if you wanted to email me or contact me, and I can give you the exact details as they apply to you. And financially is eligible. So whatever financial aid you qualify for, whether it be grants, loans, or scholarships, this program qualifies, which means that you can apply any of your financial aid to this program, which is a great opportunity as well to reduce that cost. You may be paying, you're likely to be paying much less than that $11,000 out of your own pocket.
Exactly. It makes it really doable. And I think this really allows students who may normally not be able to afford college to be able to jump into this program. It's something that is affordable. There are sponsorships too, and that's something that you might be able to speak with your own employer or another local employer to see if they might be willing to sponsor you to complete this program. So there's lots of different avenues for other lenders and employers to link arms with you and make this program fit into your budget. All right, now there are some hands-on components of this program. And so I'm wondering if Professor Barnard can give us an idea of logistically, what does it look like for students who are enrolled and looking at these hands-on experiences?
Yeah, so in your second semester, you take 8 weeks of clinical procedures 1, and then 7 weeks of clinical procedures 2. Typically towards the end, that last couple weeks of each of those classes, so the end of Clin 1 would be your Skills Camp 1. You get to come into the lab here with me if you're in Des Moines. I do have spots around the country for my out-of-state students. We get to do all those hands-on skills that you learn about in the class. So you actually get to, hands-on take blood pressures at that first one. You learn how to room a patient. We demonstrate everything, and then you show us what you can do. It's just a great opportunity to have that hands-on experience, bringing all those skills that you watched videos about, and then actually be able to do them. Skills Camp 2 is everyone loves Skills Camp 2. It is the venipuncture. So we'd learn how to draw blood on a mannequin, and then we do actually practice on each other. You do learn how to give injections, so immunizations on a mannequin. Some of the stuff is simulated, but then we do actually practice on each other. It's just so much fun. You get to meet your fellow students in person. It's a 1 day per term. It's about 6 hours, but we always have so much fun.
And that's arranged, several weeks ahead of time so that it's not a surprise to you when that's going to be. You have time to make arrangements with your employer to have that time off so you can complete those skills camps.
All right. And how about semester 3 then?
So semester 3, you have your practicum. So 160 hours is required for your practicum hours. What that looks like is I work with you and I work with clinic managers to find you a placement. The way it is broken up, it's 2 different classes, so it takes the full 15 weeks. About the breakdown is about 80 hours per class. So you typically would go in about 2 days a week to your clinical site. So you can anticipate some disruption to your normal work schedule. You can make arrangements. These are typically not weekend and evening hours. It is during the day. The clinics are open 8 to 5. So you would need to plan on making arrangements for that. It's a great experience. You're in a clinic. A lot of our students end up working and getting jobs where they are assigned. So it's just a great experience to really promote yourself and learn hands-on in a clinic with real patients, and then take a job at the end of it. Anything to add, Jen?
No, like she said, it is a great opportunity. Some students find this to be an obstacle, but it doesn't have to be. It can be a great opportunity for you to transition from your previous position into a new role, because you are going to be a CMA in just a few weeks, right? So at this point, you've got just a few weeks left in your program, and you're soon to be a certified medical assistant. And this is an opportunity for you to start to transition into that new role. So think of it as a positive rather than as a obstacle, I would say, for sure. And it's a great opportunity, as Dr. Barnard said, or Professor Barnard said. to transition into that new role, as well as look out or seek out employers and show what you can do, how good of a worker you are, your work ethic, those type of things.
Absolutely. Well, and a lot of students do after that point end up working in the same location where they complete their practicum. So it is a really important transitional part of the process, and it can help develop those connections so that you are fully employable by the end of the program. And that's what we like to see when students are walking the graduation stage, knowing exactly where they are going to be working in just a couple short weeks. So I think that's a really huge benefit of this program, along with many of our programs, that students are getting more and more hands-on, and that last semester is really the pinnacle of that transition. All right, so hopefully at this point, you are wondering what you need to do to get started, when you can get started, and what pieces you need to complete before that can happen. So I'm going to have Jen give us an idea of when can you actually start classes.
So we do have 3 starts per year. If we're going by the calendar, the first is spring semester, which starts in January every year, followed by summer semester, which is in May, and then fall semester starts in September. So they're all about 4 months apart. And we have 3 opportunities for you to start. If you don't make, for example, the January cutoff, then you could certainly jump into the next cohort or group. That would be, for example, in May. So there's 3 starts, and we're constantly graduating students from this program, which is a really exciting opportunity. You don't have to sit out and wait for a whole year for the next start to come along, or even 6 months. It's pretty quick turnaround.
Yeah, so start when it works for you.
Yeah.
And then the other piece of that is submitting your application and going through the admissions process. So Jen, admissions expert,
Sure.
what do they need to do?
So about 2 months, at least 2 months, I would say, before you plan to start. That's when you would apply online. Website is mchs.edu/apply. The application itself takes you maybe 10 minutes to complete. It's really a quick process. And you follow that up with official transcripts from all schools attended. So that would be high school plus any college coursework that you've completed. And they need to be official, which means that they are sent directly from the school to us, rather than from them to you to us. So it needs to come directly from the institution to us. And I would say that process needs to start at least 6 weeks before you plan to start the program. The goal here is to get you a timely admission decision. So once we receive those documents within about 10 business days, we can give you a response and an answer as to whether you'll be able to start, you qualify for admission. We're looking for a minimum GPA of 2.25, which is a C average in your last 9 credits of college coursework, or high school, if that's the case. But there are opportunities for holistic admission review if you don't necessarily need those qualifications. But I'd be happy to go over that more in depth with you if you have questions.
All right. And if you do have questions about that process, then I would really encourage you to reach out to Jen. She's phenomenal to work with. I'm not just saying that because I'm on camera with her right now, but she really is phenomenal at what she does. And she can answer questions over email, over phone number. And then we have put up this QR code. So pull out your phone and scan that. That's going to give you an opportunity to get on Jen's calendar, and she can schedule a phone appointment with you at a time that works for your schedule. And so you can get all of your questions answered. If you're not sure how to order your transcripts, if you're having any issues with the online application, if you're trying to figure out if medical assisting is even the right path for you, those are all things that Jen can come alongside you and answer those questions. So please make sure to stay connected. And whenever you're comfortable, go ahead and submit that application online too. That's going to be your ticket into those next steps. And shortly after you do apply, Jen gets in touch with you. And that's when you get this team coming alongside you, working with you and cheering you on. So with all of that said, I want to thank you guys for joining us today, for learning about the medical assisting program at Mercy College of Health Sciences. We really appreciate you taking the time to learn and visualize your future as a medical assistant. Any closing thoughts, Professor Barnard, Jenn?
I'm excited to have you as part of our program.
Yeah, and don't doubt yourself. Have a belief in yourself, faith in yourself. You can do this. It's possible, it's attainable, it's affordable. You can figure this out. I'll help you along the way. We've got a great team behind you, and you can do this.
All right. Well, awesome, inspiring words. Once again, thank you so much, and we look forward to seeing you here on campus at Mercy College of Health Sciences.